my darlings, my patriots, my discerning listeners, you have made a very wise choice today, so give yourself a pat on the back because you're here with me. And I think that is a wise choice indeed, because together we're going to try and put the world to rights. We're going to share our thoughts and our feelings, and in doing so make us feel a little bit better about the world we live in. Because do you know what? As long as there's conversation, as long as there's communication, as long as there's neat hedgerows and combine harvesters and the dog and duck, we're still Britain, and Britain will always be great. And together we're going to try and figure out how we can get us back to our prime, because certainly this government aren't exactly helping us on that mission, are they? And we're going to be going through, throughout the course of the next 2 hours, all the ways in which things are going so disastrously wrong. But do not ever give up hope, because we know what we're made of. We know the mettle of our pastures. We know we're made of stronger stuff, and I do believe there are brighter days ahead. Certainly, we need to hope there are brighter days ahead when it comes to the NHS. We I think those people who did vote Labour the last time round, and I still believe in the general election it was more a vote against the Conservative Party for failure. But those who did vote Labour probably thought, well, at least they might be pretty good at patching back up the NHS. And certainly when Sir Keir Starmer's asked about his achievements, he tends to focus on, well, we've got this many more appointments and waiting lists and so on and so forth. Except we're about to potentially see another round of strikes by doctors who they've been given an almost 30% pay rise. Lucky beasts. I don't think many other people can boast that. But they want another 30%-ish on top of it, and the BMA are playing hardball. They're basically saying, we've got a war chest, we're going to take you on, Wes Streeting. You can't pull the wool over our eyes. We're not going to have your mealy-mouthed promises. We're going to conduct a walkout. And then apparently the consultants who might fill in for them, could demand up to £6,000 a day. But worse still, strikes by doctors could cause 250,000 NHS appointments to be cancelled or postponed. This month alone, the walkouts may cost the NHS £87 million in staffing cover. Let's speak now to Lord Norman Warner, former Labour Health Minister. I mean, Lord Warner, if these strikes go ahead, it's any work that the government seems to have done to patch up some of those long waiting lists and the black hole that's been accumulating after COVID could essentially just be eradicated.
I think the backlog can be easily eradicated. It's been allowed to build up over a long period of time. So you can't blame all that on this particular government. The previous government has a lot to answer for the way it didn't have any workforce plan for the NHS. So I think distributing political criticism actually it doesn't take us very far. What we've now got is a situation where Wes Streeting has very little room for manoeuvre, because if he makes too many concessions of a non-pay kind, like forgiving student debt or accelerating promotion, there are going to be other groups who are going to ask for the same thing. So he's got to be ready for that if he's going to make these concessions to the doctors, and he's got to paint them as a special case. But he's also got a chance that the public will turn on the BMA. The BMA look remarkably like Unite and the railway unions at the moment. And there is a chance that he will get lucky and the public will be very unforgiving towards some of the senior doctors.
No, look, I want to echo what you said. I did say in my introduction that people who voted Labour might have voted for Labour knowing how badly the Conservatives treated the NHS, and Labour tend to have a better track record. So I did actually concur when it comes to the distribution of political blame, and also said that, you know, Starmer has been sort of announcing all of the small wins that he might have achieved when it comes to reducing those backlogs, and there's a risk that it could be wiped out. I also agree that Wes Streeting is really, you know, sticking his heels in and saying you're taking the proverbial, and rightly so. I think they are, and we know that the BMA has been radicalised by certain changes within that union. But is it enough to sort of think, well, because the patients, the everyday people who are going to be hugely disrupted, missing potentially critical diagnoses, frustrated, living in chronic pain, without a doubt, public opinion is not exactly going to be sympathetic towards the doctors, but is that going to be enough to make them not strike?
If they've decided on a course of action, and history shows this, if a trade union has got enough money and has decided on a course of action, it can stick to that course of action for quite long periods of time. I mean, what we've got here is now a radicalised trade union. The BMA has always been a trade union. That's what it is, and they have decided to dig in. And Streeting can't give this pay increase because of the effects it would have on other groups. And anyway, I don't think the government's got the money to do it anyway. So he's got to dig in, and I think he's got to now engage in effectively a war of words, which is what we're going to see. And we can see this playing out for some time. And there's now down, I think, to the senior doctors in the profession to start throwing their weight around about how the public starts to see doctors to some of their junior colleagues.
What about the cost of consultants cover, which could total £17.5 million a day? Does there need to be a word to the doctors who would choose not to strike, saying, look, we appreciate you stepping in for your militant colleagues who are not upholding their duty, but you can't charge £6,000 a day because we just can't pay you that?
If I was Wes Streeting and I was having to deal with this, I would be very quickly concentrating on a fair reward for working extra hours to the consultants, a reasonable award, and actually challenging them to accept it in the interests of patients. He's got to have a strategy in which he gets the profession as a whole engaged with this issue and not just seeing it as a matter of the residential doctors.
In the context of pay internationally, I'm certain there'll be countries with far better climates that pay doctors and nurses a lot more than we do. But we can't be that bad as a nation when it comes to the pay we're giving our doctors, can we?
Well, I think we've actually, if you look historically, the people I think we've treated quite badly are the residential doctors, no doubt about that. And there's a lot of ground to be made up because they've been neglected over a long period of time, and quite a lot is expected of them, for which if you've got people on duty at night being paid £35, £36 an hour and taking control effectively medically of 5, 6, 7 wards, that's not a reasonable rate of pay. So I don't think there's anything wrong with the idea of improving the pay and conditions of service for junior doctors. What I think the government's missed a trick is they didn't do it the first time round.
And what could, if these strikes go ahead, what could the Labour Party otherwise do to fill these gaps, to make sure that patients are not suffering as an end result? Because 250,000 NHS appointments cancelled or postponed in 1 month is a lot. And this could potentially be quite critical for certain patients.
They've now got to accelerate, I think, what's in their 10-year plan, which is to get more people going to primary care to have their health problems sorted out and treated in the community rather than going into hospitals. And one of the things which you can blame Labour for is not really doing a very good job of putting right the problems in social care. I mean, social care is basically a medicalisation of social problems, and you end up with more elderly people in hospitals who shouldn't be there. So the failure to deal with social care, I think, is a bit of an own goal for the government.
I mean, I'm one of these people who fundamentally agrees with the idea of lifestyle medicine being more promoted. I think there's a lot that the individual can do by one's own agency to make sure they don't wind up in hospital. But has there been a bit of a sort of, perhaps a sort of indulgent over-focus on that, where the nuts and bolts of actually getting the medical profession back up and running at full pelt should have taken precedent?
Well, I think certainly the idea of actually having more healthcare delivered in the communities and not in hospitals. It's been around for 20 years. And we as a country have been very slow in not pushing our governments of all persuasions to do that more rapidly than it has been done.
Why do we still cap the number of doctors we train in this country and then import doctors from the developing world? To me, that just doesn't seem to make sense. And I was reading as well, various doctors saying we're newly qualified, and when we're going for positions, there's about 20-odd people applying for the same role. It seems to me the distribution of trained medical staff doesn't seem to be working.
Well, there's a big flaw in the system for training doctors in this country, which some of us tried to deal with 20 years ago. And the basic problem is that if you keep expanding medical schools and have more and more doctors coming out of medical schools, you've got to find placements for them to do their practical training. And that relies now on the NHS to have enough money to create the posts for the training of junior doctors. I mean, that's been a long-standing problem. And Streeting still hasn't got an answer to that. Governments go on announcing, and Jeremy Hunt did this a lot in the previous government, how they're going to expand medical schools. What they don't say is how they are going to get the NHS to supply the placements for junior doctors when they come out of medical schools. And that's a long-standing problem which actually must be tackled.
But why is that so difficult? Because you would think, look, I've never trained as a doctor, but I know people who have, that certainly in the early years you might have a more multidisciplinary approach before you decide what your specialism's going to be. And what we keep hearing is that the acute end of medical care, whether it's sort of, you know, working in A&E or doing ward rounds, is where we seem to have the most issues with staffing.
That's because we have not got the bit which involves the NHS tied together with the bit that is the training in the medical schools. So then you end up with this situation where, rightly, junior doctors complain that they are actually sent anywhere and there aren't enough placements to go round. And that's an NHS funding issue. Most of the problems of the NHS do come down to money. And that's a classic example where one bit of the system is not joined up with the other bit of the system.
I mean, is therefore Wes Streeting scrapping of NHS England as a big sort of money-sucking quango a good idea operationally? Because perhaps those resources can now be channelled away from bureaucracy and administration and more to the sort of frontline services you're describing.
Well, NHS England was a major mistake by Andrew Lansley in 2012. And all it did, it became a kind of trade body for the NHS and telling ministers of all persuasions that they needed to put more money into the NHS, whereas what you really needed was the NHS to do things differently, as finally the 10-year plan is starting to say.
Lord Warner, thank you ever so much. A great conversation with Lord Warner, former Labour Health Minister. 20 years of the same mistakes being made. Why don't people listen to those who know what needs to be done? I have no idea.